Welcome to your spine mobility flow, something that feels so yummy to me. So rather than just working on flexion and extension, we're actually going to work on that lateral flexion and rotation, and then we're going to take it around in a full circle to really get that spine nice and juicy. So one of my favorites, seriously one that I go back to all the time, because you could do it standing, you could do it to get out of your desk, you could do it to get off your phone and stand up from sitting position, and really just something to get you up and moving and opening through that spine. A lot of people also complain of rotated hips or hip shifts or your QL being super tight, so this is a great way to kind of open and release that area. Plus, we're going to think about creating stability in order to create more mobility. So one foot in forward, the other foot's going to cross behind, and just until it feels comfortable for you, you don't have to like really reach it out there too far. The other hand, the hand that's same leg in front is going to slide on the inside, and the other arm will come up. Now, rather than just bending over as far as you can, you actually want to press into this hand in front. So I want you to use this as feedback for that knee to push in. This is going to create some stability at that pelvis, and then we're going to use the breath to guide over as far as you can. Now you're going to be breathing into this side rib cage here, trying not to come into flexion, but staying so straight on that side, pulling in with that knee, open, relax. Five good breaths. And then coming right back out. Whoo, so you should feel that whole side open up. It feels so wonderful, I promise. So coming in. And what also is great about having the stability of the hip as you reach over and you breathe, so do your 5 breaths even as I talk, you want to make sure it helps so that you're not crunching into your spine or anything, but you really lengthen, reach, and create that stability at the pelvis so you're not hurting anything. So, or you shouldn't be. If you are feeling any pain, make sure to back off a little bit, reach a little bit higher before you reach over. Really trying to get even from this lat, which attaches into our arm, to be nice and open all the way down to that QL, okay? And this will really help to elongate and open so we really get that lateral part of the body, the sides of the body, to really be open. So hopefully you're still going as I jabber away. Next one is going to be rotation. So we're going to have the legs kind of about hip width apart. And as we shift side to side, it is okay to have a flat foot and kind of a supinated or arched foot. So flat. And as you notice, the knees kind of go with the feet, and they'll rotate with it, and the hips come with the feet. Okay, so this is good feedback as well. Hopefully you're not wearing shoes. And we're just going to shift into one side. Hip is going to stay back, and we're going to use the hand on the outside this time to create that stability through the hip. So now my hand is over here. My knee is going to press into my hand as my elbow drops down, and I open and reach. Now from here, I want to think of my sternum rotating, my shoulder blade pulling back, and then I'm still breathing and opening through that rib cage. 5 deep breaths. So you should feel that good rotation. These two are just some of my favorites again, okay? So shifting back into that hip, hand on the outside, pressing into that knee, and then opening, rotating, breathing into that rib cage, letting that shoulder blade pull back. So again, creating that stability at the pelvis and at the feet all the way up as we create that mobility through the spine. You don't have to rush the breath, so make sure you go nice and slow. Deep breaths, 5 of them, at your own pace, okay? Next one, we're going to do what's called spinal cars, or this is just controlled articulations in that end range of motion. So we're really going through what your range of motion can be at all sides, so flexing, side bending, extending, rotating, all of it. And this was kind of coined from Dr. Andrea Spina. creating FRC or functional range conditioning, and we're really thinking about utilizing our whole range and creating a little tension so that we really teach the body it doesn't have to be tense and tight, but it can activate and move and go into these different positions, so we really free up the spine. So we kind of got in a passive way of opening and breathing and moving and feeling loose in the spine. Now we're going to activate it a little bit. So I want you to kind of ground down through the feet, bend the knees just a little bit, keep those hips kind of tuck just a tiny bit so that the glutes can kind of come on and the abs are on. So we're going to try to focus more on the spine moving around the sternum. It's okay if it gets into the low back as well. Okay? Create little fists in your arms. So we're creating a little bit of tension. Not like 100%. I'm not like, going red in the face. I'm still breathing, but I'm creating a little tension. Now what I'm going to do is drop the chin round into my sternum. So again, right around the sternum. Now I want to rotate as much as I can to one side. Then I'm going to side bend, so kind of opening right around that sternum, right to the side, and then I'm going to extend. Again, not into my low back, keep those buns tight, but lift the sternum to the sky, side bend to the other direction, completely to the side, rotate around that sternum, and then flex as I come back, and then right up. So because we're standing, we're not thinking about getting into the entire spine. A lot of times people will just move again around one segment or around that low back or where that low back meets the upper back. We don't want to just be able to hinge from that joint. Okay, we want to be able to move in all ways in all the joints. So again, tension in the feet, tension in the legs, rounding down in the spine, rotating first, rotate that sternum, and then side bend around that sternum, extend, lift, and open that sternum right between the shoulder blades, and then side bend over to the other side, rotate around that sternum, and then flex right back into the middle. So we just did 1 to each side. You could do 3 to each side. You could do 5 to each side. Ultimately, listen to your body. Feel, am I moving from that upper back? Am I just moving around my low back? Is my pelvis moving with me? Okay, this is all about building that awareness and getting to know your body.